Hi, I'm Hannah. Welcome. This is the Theology Therapist YouTube channel. I'm so glad you're here. This week we are going to talk about the 6 trauma therapy techniques that I think that you should really know about. Remember, before we get started, to press the subscribe button and the bell so you get notifications on all weekly updates. Let's get going. Okay, so I just want to be clear about one thing. I am a therapist. I am a clinical social worker. I have a private practice based in Massachusetts where I work with clients who have experienced some trauma. But I also want to be upfront that I'm going to talk to you today about some techniques that I don't specialize in. So just because I specialize in trauma doesn't mean that I specialize in all of these that I'm going to talk to you about today. But I think that they are important. They have had a lot of success. A lot of people really like them, and I think you should know. The first one is called EMDR. It stands for eye movement desensitization and reprocessing. So it's become really popular in the last, we'll say 10 years or so, and it uses bilateral stimulation. So the bilateral stimulation is done many ways via like a pulsing thing, like you hold on to a thing and it sends kind of pulses into your various hands. You can do it even by tapping or, like hitting your legs, tapping your legs. So the bilateral stimulation can be done in a variety of ways, but it uses bilateral stimulation across the body to target memories that are causing distress and use that to desensitize to these memories and to then reprocess them so that they are no longer causing so much distress. A lot of people really love this type of therapy. Sometimes after this kind of therapy, people will report feeling really fatigued, needing to take a nap, but kind of like it's like taken a lot out of them. And that's what happens when in this process of forming these new neural pathways and really going deep on something that was traumatic or extremely upsetting or something that's still distressing, and being able to find like new ways of thinking about it. So that's the first one, EMDR. The second one is called cognitive processing therapy. It was developed and primarily researched with veterans. So it's used quite a bit in the VA, in the Veterans Affairs hospitals. And so cognitive processing therapy, this is one that I use in my practice. It is a short-term treatment. So like EMDR, is like a little bit more flexible in the way treatment can be structured. Although there are stages that you follow, you'll see in a second that it's not manualized treatment, so it's a little bit less structured. Whereas cognitive processing therapy is a manualized treatment model. And you might not know what that means. What is manualized? So you have a book here, you have a manual. This is not my CPT manual, but you have a manual here. I have one that looks just like it. This is the closest one that I could grab. So you have a manual, and in that manual, it tells you like step by step what needs to happen in each session. And you might be like, but Hannah, my story is unique. My experience is unique. How is it that you can do something exactly the same way? I hear you. I get that. CPT is a really great option because, for some folks, because it's so structured. And it doesn't really have anything to do with the trauma itself, the experience. It really has more to do, I would say, with personality, life experience, or a life circumstance at the time. So essentially what you do is you identify all of the beliefs that are keeping you stuck, and then over the course of treatment, which is generally about 12 weeks, you work together with a therapist in order to adopt or develop new beliefs that are more accurate, more realistic, more helpful. And along that time, you also start to incorporate some things about how to better take care of yourself. But really the focus is on beliefs, right? The things that are keeping you stuck, and avoidance. Avoidance is a primary target of treatment. So these are the kind of highlights of CPT. So number 3 is prolonged exposure. Prolonged exposure is probably one of the oldest trauma treatment modalities. It's also probably the one that makes everybody cringe the most, because essentially what you're doing and the idea behind it is like the more that you are in contact with something, the more desensitized you're going to become to it. And so, prolonged exposure could have outings, right? Like if you're mugged in a subway, like you might like step by step or little by little kind of go back to a subway, with the support of a therapist. It might be in like a written form of, kind of rewriting over and over again the event itself. Okay, so PE, it's probably the one that in my experience people are the least excited about. Okay, number 4, the 4th trauma therapy technique that I think that you should know about is called IFS. It stands for Internal Family Systems, and it was popularized through a book called No Bad Parts. You might want to pick it up if you are interested in this, but essentially it says that there are no bad parts of ourselves, even the parts that are causing some issues now, right? And maybe there's a part of you that really doesn't want to think about what happened and it is strong on avoidance and is the one that's opting for alcohol. IFS says that part of you isn't a bad part of you. It's actually doing some things in that it's trying to help you. IFS, I think, I would say it's getting really popular among therapists. It's probably less known among like clients, lay people, but it tends to be, I would say, like a little bit more meditative in its what it might feel like, what you might recognize that it might feel like, right? The therapist might have you, close your eyes or imagine, X, Y, or Z, visualize certain things in your body, etc. And so it's, I'd say, less cognitive, more, like I was saying, it's more mindful, and it can be really deep. It's parts therapy, might also be called like ego states. So it's a little bit more of like an easing in, but there's some serious or intense depth. The 5th trauma therapy technique that I think you should know about is called somatic experiencing. Now, this is a really different type of trauma therapy than the ones I've talked about already, because as opposed to focusing on emotions or your thoughts or beliefs, somatic experiencing focuses on the body. It starts with, and the basis is formed by what is going on in the body. And so really what it does is it looks to address over or deactivation of specific parts of the body. So you might have heard of something called polyvagal or like nervous system regulation. Like these are all things that are talked about a lot in somatic experiencing. And so you might learn like vagus nerve resets, right? Like this, pressing, like these types of like sounds, like there's these points and then you make like a voo sound, right? You're like, what the heck are you talking about? These are all kinds of things that you learn and you do in somatic experiencing sessions. And I just want to be clear that it is and was specifically designed for trauma. So even though it's not like, it doesn't start with thoughts, beliefs, emotions, it is a specific trauma modality. And I just might add that I think that it's actually a really nice, a really helpful addition. As a trauma therapist, you really want to have like a lot of tools. I want to have a lot of tools in my toolbox, and I think that it's a really nice, helpful addition to so many of the other therapies out there that have in the past been so like emotion and thought-based, that it is really refreshing to actually have access to these body resources. Okay, number 6, the last one is, drumroll, psychedelic assisted therapy. Have you ever heard of that? Could you imagine a therapist recommending to you psychedelics, because a lot of times I have clients who really don't want to tell me about some of these like recreational drug usage. But no, actually, there's a lot of research and more that's coming out now about how psychedelics can actually help us bypass some of those cognitive blocks that we have and access and heal some of those old wounds, some of those wounds that are active. And so it's done with the support of a therapist. But a lot of folks who grew up in very rigid, high demand, high control religious environments benefit significantly from like a ketamine assisted type of therapy or a different psychedelic assisted therapy, because that rigidity is really hard to let go of. Like, you can leave the fundamentalist group, but it's that rigidity doesn't necessarily stay with the fundamentalism. It often comes with you. And so having the support of psychedelics in this case can be really supportive to bypass a way of thinking or being that you've been conditioned to be. Okay, so those are my 6 trauma therapy techniques that I think that you should really know about. And if you are looking for a trauma therapist, you should definitely check out some of those and ask a therapist that you're interviewing if they specialize in any of those. Thanks so much for being here. I'm gonna link this video about trauma therapy. If you've liked this video, I think you're really gonna like this one. Remember to subscribe, hit that bell so you can get notifications on all weekly updates. I'm Hannah. I will see you again next week.